Good morning and welcome to today's Toolbox Talk, which is covering silica in stoneworking. And this is from new advice for installers of stone worktops. So the Health and Safety Executive have created new advice for installers, their managers and supervisors who are involved in the installation of stone worktops. They have created this in partnership with the industry to help employers protect workers from the risk of silica dust. The advice provides those involved with simplified information covering the following areas. So the first one is for competent staff and effective processes. So the do's. You must ensure that you and fellow installers are trained to work with stone and know how to report any issues occurring on site. You must regularly check and maintain any equipment, tools or controls that may be needed on site. So ensure filters are on for tool extraction, vacuums and RPE. You must not use untrained installers, handling and fitting stone worktops, even without on-site fabrication, as this could put their health at risk. And don't provide or use inadequate or poorly maintained tools or controls. For the pre-installation part, check the specification before starting installation and ensure that any optional aspects, such as cutting drainage grooves, are resolved. Eliminate on-site fabrication as much as possible, so cut out sink or tap holes in the workshop. Clean dust off worktops before transport to site by wet cleaning or use of a Class M vacuum. Use accurate measurements for fabrication and identify any fabrication tasks that must be done on site and any controls required. You should develop a safe system of work and ensure that all facilities, such as adequate water supply for suppression of segregated areas, are available. Do not be persuaded to carry out additional fabrication tasks on site that have not been covered within the specification. Do not carry out fabrication tasks on site that could be done in the workshop. Thin overlays and upstands may need to be cut on site if they would be too fragile for transportation. Do not rely on poor measurements or estimates that make it more likely that fabrication of finishing may need to be taken on site. And do not assume any combination of controls will work. Check you know the right combination and how to correctly use them. For on-site installation, do any repairs on-site modifications in a well-ventilated, segregated area with restricted access, so ideally outdoors, using appropriate controls. Do shut down any local heating systems with blowers or air conditioning units that could resuspend settled dust and increase airborne concentrations. And do use appropriate controls. So apply on-tool controls like water suppression or on-tool extraction. Also use RPE with APF of at least 20 to protect against mist and dust, unless monitoring data shows this level of protection is unnecessary for adequate control. Do not carry out major modifications on site. Take your worktop back to the workshop. Don't assume that all air movement is good ventilation. Check that any airborne dust is being carried away from your workers. And do not rely on RPE alone unless your risk assessment shows it is adequate. Post-installation. Ensure you clean up after installation using wet methods or low pressure wet hosing or vacuum dust Class M and RPE. Discard all stone waste materials, wet slurry and captured dust properly in a safe manner. And do avoid transferring dust between areas by keeping PPE clean. So use a vacuum to clean overalls when leaving a dusty area. Don't use any cleaning method that creates airborne dust. So, for example, dry sweeping or compressed air. Don't delay cleaning up. Wet slurries can dry out and dust then becomes airborne. And don't use dry brushing or compressed air to clean dust off work clothing. There is a more detailed guidance on the pages for installers available on the HSE website. Installing stone on worktops. Protect against harmful or natural or artificial stone dust. The British Occupational Hygiene Society has created a useful presentation known as silica dust, which covers the risk when working with engineered stone. So how do we control exposure to keep workers safe? Respirable crystalline silica, or RCS, is generated during the working of stone in stone manufacturing, processes such as cutting, chiseling and polishing, and can generate high levels of stone. When these materials are worked, dust is created, which may be fine enough to be breathed deep into the lungs and cause devastating lung diseases, including silicosis, chronic obstructive pulmonary disease or COPD, and lung cancer. These lung diseases ruin not only the lives of those that are suffering, but also their friends and families' lives. And although irreversible, these diseases are preventable. So what employers need to know? Exposure to RCS is subject to the control of substances hazardous to health regulations. And as an employer, you are legally responsible for taking effective measures to control exposure and protect workers' health. These measures can also improve production and cut out waste. Effective controls is likely to be achieved by a mixture of controls, including LEV for dust extraction, RPE, and water suppression and process changes. The amount of dust workers are exposed to depends on a number of factors, which include the type of stone they are working on, and this includes both natural and artificial or engineered stone, the type of tool they are using and whether it is powered or handheld, how long they are looking at working with the tool, how well you're using any extraction systems, so LEV, the effectiveness of a mask, so RPE, and how your workshop is organised, which would include segregation of dusty activities and housekeeping arrangements. You also have a duty for health surveillance. So health surveillance for silicosis should be considered for workers who are involved in high-risk occupations, including cutting, chiselling and polishing. I've now got a short story about two workers, Kevin and Tony Winter, who were stoneworkers. 52-year-old Kevin Winter and his brother, 62-year-old Tony, are from Barnard Castle and are both former quarry workers. They were diagnosed with the irreversible lung disease, silicosis, just a year apart, Kevin in 2007 and Tony in 2008. The silicosis was caused by the exposure to silica in stone dust during the combined total of 72 years working in the local quarry, where Kevin was a stonemason and Tony a stone cutter. The dust levels were very high, but they were never told about the dangers. Some control measures were put in place in later years, including a dust extraction system, but as they weren't maintained, they were ineffective. Since ill health forced them to leave the quarry 14 years ago, Kevin has been working as a shelf stacker in a supermarket. He finds it physically demanding, but is conscious that it is a tough job market, particularly for somebody of his ongoing and debilitating condition. Kevin, like Tony, has lost 30% of his lung capacity through silicosis. He struggles to walk even short distances on an incline, and he worries He might be in a wheelchair before he reaches 60. Both he and his wife Anne worry about what the future holds. Tony's condition is also having a very significant impact on his quality of life. And he says, "I wouldn't wish this on my worst enemy. It's like a death sentence." Tony cannot walk very far without needing to rest. He becomes breathless just climbing the stairs, and on bad days has a constant dry cough and a burning sensation in his throat and chest. He cannot kick a football with his grandsons, lift one of them up, or even push a pram, and he sadly has to avoid them if they have a cold in case he picks up any infections. Tony is also particularly conscious of the efforts it is having on his wife Greta, who has to do everything for him, and he worries that he's holding her back. Tony wishes he could turn back the clock. Now he wants to tell other young workers to think of their health. If you don't think the protection is adequate, complain about it. Kevin echoes his brother's sentiments. He wants to tell young workers in the industry to be really vigilant against the dust and to use all the protective products on the market. Test them, and if they're no good, get something else. Thank you for your time.